Moving a patient between hospitals isn't as simple as just booking a ride. Bedside-to-bedside service ensures a smooth, medically supervised transition. In this video, I'll break down how it works. My name is Bryan. I'm the Director of Medical Operations here at REVA Air Ambulance. If you have more questions about medical transportation, check out the other videos on our channel. What is bed-to-bedside service? So bed-to-bed service, simply put, is being able to see the transport, the entire service from the discharging bed all the way to the admitting bed as a team. So a true bed-to-bedside service is when we send a team out to repatriate somebody back to their home country. What we simply do is we ensure that when our team lands in the country that the patient is currently in, or the destination that they're at, our team goes bedside in that area, assesses the patient, and is able to clear them. Once they take them back, they will safely fly them from that destination and fly them all the way back to either their home country or wherever they're planning to go. And when we land there, we take that patient all the way to the hospital as well, and we give a handoff delivery care to the admitting hospital. Why is bed-to-bed service important? So one of the most important parts of bed-to-bed service is obviously the continuity of care. You have one crew with the patient from point A to point B that knows everything about them and can see everything that occurs from a ground ambulance ride to the aircraft portion of the transport to the other ground ambulance ride to the admitting hospital. Minimizes any risk or breakdown in communication, also builds rapport with the family and the patient on a trust level, and ensures safe transport throughout the process. Because there is a fear sometimes when you don't do a true bed-to-bed service that things may go lost in translation if you hand over to another crew that wasn't with the patient for X amount of time prior. What are the types of bed-to-bed transport? So there are a couple different types of bed-to-bed transport. Obviously, the most standard is hospital bed to hospital bed, but there are a couple other instances in which you may pick up a patient that is in their residence and you might take them to a hospital, or vice versa, hospital back home to their residence. You also have the ability to take patients from a hospital to a long-term care facility, skilled nursing facility, or some type of rehab. And then there are also just circumstances where the patient might be transported from wherever they are to an FBO, and they have their own transportation and whatnot arranged as well. Who needs bed-to-bed service? Simply put, who needs bed-to-bed transport would be most of our patient population. Those who are critically injured, those who are critically ill, patients on ventilators, patients who require constant cardiac monitoring, patients who are on IV drips, vasopressors, things of that nature. Also, some of our elderly population as well who do need that further assistance and are not capable of being left at home or taken to a home, and they need that supervision and medical assistance 24/7. So those are just to name a couple of the most commonly utilized bed-to-bed services. How do you choose a reliable bed-to-bed service provider? For me, the question is quite simple, as doing the research into the medical providers that have active accreditations. They have a very in-depth history and background in doing this routinely, that they're a company that operates safely and has all the necessary medical equipment available, and then some. Operators that have true critical care transport teams and capabilities. Also understanding their background and how long they've been doing this for. Some of the most important questions to ask before booking with a company is asking what their teams are made up of, or the aircraft in which they're flying, or the pilots. Asking those types of questions are very important because it varies from aircraft to aircraft, company to company, and certain companies might run different team configurations. So having an understanding of the scope of practice of the teams on board, what is available to your loved one should they have an emergency on board the aircraft, and what the plan of actions would be if something did happen.